We have representatives from DUville College, professors and students, to present an educational program on prescription drug abuse called GenRx. This educational program was started in Ohio and is now also presented in the Buffalo area. So I'd like to thank them for coming and spending the time here with us today. It's quite a drive for them to come, so I'd like to thank them for coming all this way to present this information, which is an important issue. One of the participants in the presentation is Josh Cahill. Josh is a 2008 Waterloo graduate and is now a pharmacy student at DUville College. And we're happy to have him come back and be part of this presentation with us. So at this time, I'll turn it over to Alex to introduce the presenters and the program.
Thank you very much. Hey guys, how are you guys doing today? Good to hear. You know, just 4 short years ago, I was in your very seat. I would have been sitting next to you, except I went to kind of a rival Victor High School. But still the same, we're not far off from where you guys are. But anyhow, we're here today to talk to you about Generation Rx, a program that was designed to prevent the misuse and abuse of prescription medications. We're all student pharmacists from the School of Pharmacy at DUville College in Buffalo, New York. My name is Alex. This is Greg to my left. Greg's going to be handing out prizes today for our audience participation. So if we ask a question, raise your hand and we'll call on you, and you will have the potential to win a prize. And we also have Chrissy, who's on the computer helping us run our presentation. So now I'm going to hand it off to Josh.
Hello guys, so like Sergeant Kraft said, my name is Josh. I graduated from Waterloo High School in 2008. I was involved in Student Council and National Honor Society during my time here. I'd also like to introduce 2 faculty members that we have with us today. We have Dr. Michelle Lewis up front, and we have Dr. Stephanie Bryan, who's taking pictures in the back. So, like Sergeant Kraft said, Generation Rx was started in Ohio at the Ohio State University College of Pharmacy. It was founded in partnership with the Cardinal Health Foundation, and it's supported now all throughout the country by the American Pharmacists Association.
So this morning we'll be talking to you about some stats and myths regarding the consequences that come with abusing these medications. Let's get started. How many prescriptions do you think are purchased in the United States each year? Raise your hand. Greg's going to call. 3.8 million. That is not correct. 3 billion. Still not correct. One more, Greg. Not Tom.
5 billion? 5 billion.
5 billion. All right. So the actual answer is 3.8 billion prescription drugs are purchased in the United States every year. So you're very close. But 3.8 billion, that's a lot of prescription drugs. And that's just in the United States alone. So let's see if we can understand why there are so many prescriptions being purchased.
So direct-to-consumer advertising is one major reason why so many prescription drugs are purchased in the United States. Our government allows pharmaceutical companies to control prescription drug advertisements. So we as the public see these products advertised everywhere, like on TV commercials and in magazines. We'd like to see how many of you have experienced advertising like this. So raise your hand if you've ever heard of one of these prescription medications. All right, take a look around, guys. You can put your hands down. The majority of you raised your hands, so we can see that pharmaceutical companies are doing a really good job of marketing their products. But most countries don't allow this type of advertising. Only 2 countries in the entire world allow direct consumer marketed advertisement of prescription drugs. Does anyone want to try to take a guess, besides the United States, which country allows this type of marketing?
Country, not continent.
All right, the first guess was Canada. That's incorrect. All right, the second guess was England, and that's also incorrect. All right, the last guess was North Korea. So actually, New Zealand and the United States are the only 2 countries that allow this mass marketing of prescription drugs. United States, we've all grown up in a culture that purchases a lot of prescription drugs, mostly because we see these products each and every day through advertising. This fast marketing of prescription drugs has led to the term Generation RX.
Generation RX is the title of a book written by an author named Greg Krister, and in this book he refers to the term pharmaceutical populism, which he defines as a growing culture of self-diagnosis and self-prescription. So it seems like we as a society have started to take doctors out of the equation by self-diagnosing our own illnesses and self-prescribing these medications. It's important to remember that there is a reason that the medications must be prescribed in the first place, and we are not in a legal position to self-diagnose or self-prescribe, and we need to leave this up to the doctor.
Alright, so we know that close to 4 billion prescription drugs are purchased each year. Now let's talk about how these drugs are being abused. In 2007, 7 million Americans aged 12 or older abused their prescription medication. In 2008, 1.9 million American youth alone between the ages of 12 and 17 abused prescription drugs. Did you ever think the number of prescription drug abusers was that high? Or even that so many youth, people your age, had abused a prescription drug? As you can see here, there are just as many new abusers of prescription medications as there are of marijuana. That's pretty scary, guys. And if you look closely, you can tell that people actually abuse pain relievers the most.
So Josh is talking about those stats, 12 to 17. How old are you? 17. How old are you? 17. You're Josh's sister? 16. So guys, these stats are all about you. This is the age group. So you might be surprised that each day an average of 2,500 teenagers use a prescription drug without a doctor's guidance for the first time. So before we go much further, let's figure out the difference between misuse and abuse. Misusing a prescription is when you take a medication differently than it's been prescribed, like at a higher dose than recommended by the doctor, or using another person's medication. And using a prescription to experiment, get high, or improve grades is considered abuse. So we're buying a lot of prescription drugs, 3.8 billion, just in the US. We know that some of them are being misused, and we've seen that prescription painkillers are being abused the most. To some people, abusing prescription is almost normal, and that they think it's safe, but this is the truth about painkillers.
There are people like you. They made one bad decision to start abusing prescription medications. It affected their health, it affected their family, it affected their life. It's pretty serious stuff. The number of deaths from prescription painkillers in the United States recently surpassed that of skin cancer, alcoholic liver disease, and HIV. So do you guys think teens are a part of this problem? What do you guys think? Yeah? General consensus is yeah? More than 1/3 of teens say they felt some pressure to abuse prescription drugs. So take a look to your left and your right. Go ahead, take a look. Between the three of you, one person has felt some pressure to abuse a prescription drug. Now we're not saying you guys in particular, but the statistic is 1 in 3 teens have felt some pressure to abuse.
Almost 10% of teens think that using prescription drugs is an important part of fitting in with their friends. 10%. 10%. What does 10% look like? Can I have this row, this row, this row, this row, and this row stand up, please? All right. Now you can take the nervousness off me and look it down. That's 10% in this room. It's not a lot, right? So, of you guys standing up, what's one reason besides fitting in that you might feel pressure to abuse a prescription drug?
You get a t-shirt, if you get it wrong, you still get candy. So one reason why you might choose to go to the drug. What? To get hurt. One reason why you might abuse it.
His answer was to get hurt,
Fit in.
to fit in. Greg, one reason besides fitting in. To be friends, to fit in. Peer pressure, fitting in. To get high. That is one reason. So fitting in, to get high, what's one more reason? Might help you feel better. Not quite. Helps relieve pain. That is a correct answer, Greg. Excellent. You guys can sit down. Thank you. So some say they abuse prescription drugs to get high, relieve pain, improve grades, or to fit in, or peer pressure, as we heard about 12 different ways. So do you think any of these reasons surprise you? You may not think to improve grades is a reason, but some students abuse prescription medications so that they can stay focused for long periods of time and cram for an exam. Remember that unless you have a prescription, any of these reasons, any of them, fitting in, any of them, are considered abuse.
All right, so when we look at the top 5 drugs abused by 12th graders in the year 2006, we see that prescription drugs represent 4 out of the top 5 abused drugs, only beaten by marijuana. And that was in 2006. We know now that prescription drugs have surpassed that. Even though 40% of teens consider the abuse of prescription drugs to be much safer than street drugs, the improper use of these medications can be dangerous and addictive, as we saw in the video. Now that we've seen that prescription drug misuse and abuse is a problem in our country, let's try to bust some myths regarding prescription drug abuse.
All right, so the first myth is that prescription medications are safer to abuse than street drugs. You would think, right? They're prescribed by a doctor, you have to buy them over the counter or behind the counter. Actually, prescription drugs are powerful medications, and if you take these medications inappropriately without a prescription, there is no telling how they may affect you. Abusing these drugs can stop your heart, your breath, or both. The bottom line is that abuse of prescription drugs is every bit as dangerous as abusing other substances. They do not offer a safe way to get high, cope with stress, fit in, or perform better at school.
All right, so the second myth is that sharing a prescription medication is legal. Only a doctor or pharmacist can legally give you prescription medications. Using these medications, many of which are considered controlled substances, without a doctor's prescription or misusing someone else's medicine is harmful, not to mention illegal. If you take a prescription for a legitimate medical reason, don't share your medications with anyone. You could unknowingly be putting your friends at risk.
And the final myth we'll bust is that nothing bad will happen to you or your friends. Teens often mistakenly believe that prescription medications are safe because they are approved by the United States FDA and are prescribed by a doctor. But in reality, all medications have risks, and they are only safe when taken as directed by the person to whom they were prescribed.
All right, so you guys might be saying to yourself, what's the big deal? I see my parents, siblings, and other family members take prescription medications every day. But abusing prescription medications is a slippery slope. Virtually every medication has some risk associated with it. Doctors think about the potential benefits and risks to each patient before prescribing a medication. They understand how a drug impacts the body in many ways and take into account things like the person's body weight and what other medications they're taking. We also think about side effects, the possibility of addiction and withdrawal, just like we saw in that video. Healthcare professionals know how long it takes for medications to dissolve in your stomach or to get into your bloodstream. And we also think about other factors that are specific to each individual patient.
All right, now let's put everything that we've learned all together for you. So we know now that prescription drugs are not safe alternatives to street drugs. Not to mention they can be just as addictive. Lastly, possessing a medication without a prescription is illegal and a felony offense punishable by jail time. The reality is that most teens know it's not worth the risk to misuse or abuse prescription medications. It's important to remember that prescription medications, when taken as intended, are very helpful to a lot of patients. So we said earlier that 10% of teens say that abusing prescription drugs is an important part of fitting in. That means 90% don't think it's an important part of fitting in. So for all of you who didn't think you were going to stand up before, except for those 5 rows, everybody stand up. All right, guys, now look around. So this is 90% that don't think it is an important part of fitting in. Can you guys say that with me? 90% don't think it's an important part of fitting in. 90% don't think it's an important part of fitting in. All right, excellent. You guys can sit down. So, 90%. That's the majority of teens that are not abusing prescription medications. So we want to encourage you to be part of that 90% and to reach out to the other 10% of teens who think they have to abuse medications to fit in.
All right, so we'd like to thank you guys for having us here today, and we'd also like to say if any of you are interested in pursuing a potential career in pharmacy in the future, definitely talk to your guidance counselors, and we'll give them some information about Hugh School of Pharmacy. I think we've run out of time. Do we have time for maybe one question?
Sure.
Anyone have any questions? No? All right, thanks guys for having us.